When it comes to teen pregnancy, the U.S. ranks substantially higher than other industrialized Western countries. The Centers for Disease Control and Prevention says the U.S. has about 24 births per 1,000 girls. The teen birth rate in Rochester is about 1.6 times the national rate and 2.5 times the rate in New York State. That's according to the city of Rochester. But this is a story where the narrative is slowly changing, and innovative approaches like this week's surprise Valentine's Day card drop at various city schools are trying to make a change. Take a look.
Today we're at Edison for Valentine's Day, and we're having a Baby You're the One campaign.
It's a campaign that gives you information on unplanned pregnancy and how you can prevent it. And if you are somehow pregnant, there's a card in there that lets you know places you can go in Rochester area to get help, anything else you need.
Baby You're the One is basically saying, baby, you're the one that's gonna have to change all those diapers. Baby, you're the one that's gonna have to hold your dreams back just because you have a child at a very young age.
I believe it's important because a lot of kids are having unplanned and unsafe sex, and they are having a lot of consequences that goes along with it, like STD, AIDS, and some people are not stable enough to have a child and they're not prepared for it. So we're letting them know where you can go if you're not prepared.
I thought it was emotional because, I'm the son of a mom that was 15-year-old, and she had me at the age of 15, so it's kind of like personal about being safe and make sure you get in the right way, in the right path.
I think it went good, but some people was upset about it. And
Why?
They didn't get the message of it. They just opened it and was like, oh, I don't care about this. They didn't read to see what it actually was. But other people, I think it will laugh.
We want people to talk about it. We want people to understand unplanned pregnancy. You can always prevent it.
So where do things stand now with Rochester's historically high pregnancy rate? What are the risk factors? What's the link between pregnancy, teen pregnancy, and poverty? And in what ways are changes being made? Joining me for this discussion is Marisol Ramos Lopez, Commissioner of the Department of Recreation and Youth Services for the City of Rochester. Charlie Craw-King, Manager of the Teen Pregnancy Prevention Programs for the City of Rochester. And Natasha Walker, Health Educator with Metro Council for Teen Potential. And welcome to all of you. I appreciate you being here.
Thank you.
So to begin, viewers will be hearing, as they've already heard, a number of stats in connection with this discussion, but I want to paint a picture so that they really understand what we're talking about here. According to a recent report published by the City of Rochester in partnership with Metro Council for Teen Potential, in the year 2019, the 326 babies that were born to Rochester teen mothers in 2014, if grouped all together, would fill 15 kindergarten classrooms. And that's something that you just need to let soak in to really get an idea of what's happening. Right. Natasha, what are some of the factors that contribute to teen pregnancy to get us started?
Well, what we all know is poverty, and we all know that the areas in the city where the highest teen pregnancy rates are the areas in the city where the highest poverty rates are, and that's the connection that we all have noticed throughout the years.
How do you explain that correlation, and why do these two connect?
Anytime that, if when you look at poverty as it relates to teen pregnancy, you have young mothers who may not be able to complete their education because they have become pregnant, with the unplanned pregnancy. Also access to health, access just to the knowledge that health educators such as Natasha is giving them through the programs that we're offering. And historically, Rochester has had very high rates. Through the years, they are coming down, and I would say from 2008 to 2014, there's been an influx of funding from New York State Department of Health, as well as the U.S. Department of Health and Human Services Office of Adolescent Health, in order to help our community, with bring those numbers down. But we still have a ton of work to do.
Well, you mentioned in 2008, so that was a peak year. 15.6% of young women between the ages of 15 and 19 were pregnant with that number. And yes, we've talked about this drop that we've seen since 2008. So as of 2014, that number was 6.3% in the city of Rochester. You mentioned the federal funding that has come in that has helped address this. But I want to kind of go back for a moment. What has changed when it comes to educating young people about teen pregnancy? Do these conversations look different now than they did, let's say, 10 to 20 years ago?
They absolutely do. These conversations are more direct. These conversations are about what happens when you have sex. It isn't necessarily just talking about abstinence, but it's also talking about taking care of yourself, health, sexually transmitted diseases, and the impact of pregnancy on your life, on an unplanned pregnancy when you're young. An unplanned pregnancy in a family creates a stigma. It causes some setbacks when you're talking about financial work or even education. Imagine the setback that it causes for a young person who doesn't have skills and resources to now try and bring another life into the world and manage it through the systems, through education, through work life. Those are very difficult. So the conversations that we have with young people today are very straightforward about what will happen when you get pregnant.
Yeah, and that's most of what my job and what I feel so passionate about and why we're here. As a health educator going into schools like the clip that you just saw of Edison, that's me. I'm in there teaching these kids about what's really going on and what are the real consequences. And we do keep it straight with them and we do tell them. And it's always so funny to me because we have outside partners like Highland Family Planning, and they come in and give great birth control demonstrations and talk about birth control and long-acting birth control. And it's so funny because whenever they come in, the males in the room always want to just kind of go like this or put their heads down. And I say, no, this is a two-way conversation, because if a young lady does get pregnant, that's both of your responsibilities. So you need to listen. This is a conversation for you as well, because it's your responsibility to have that conversation with your partner and to know what kind of birth control are you using.
And that's what was so unique about that Baby You're the One campaign, because these cards were going out, some to young men, the other cards for women. And so then the young men could see, well, this is exactly how you're affected by this baby.
Absolutely.
Exactly.
This is a two-way conversation.
Right, and I also want to add that we're using more evidence-based curriculum. So our educators are really trained. They're certified to deliver medically accurate information to the young people that they're talking with. So that has changed over the 10 years. The city of Rochester was involved in a study to see what type of programs work best in urban communities such as Rochester, starting in 2010. And last year was our first year rolling out. We're really trying to bring it to scale, reach as many youth as we can.
Well, what are those programs? Because we were all teens, okay? And I remember, as a teenager, I thought I knew everything, and then nobody could teach me anything. So how difficult is it? You've got these programs, but what types of programs are the most effective at reaching teens?
The city of Rochester is using the Making Proud Choices, which give, again, medically accurate facts, and also give them skills when it comes to refusal skills, information about what are healthy relationships, what are abusive relationships look like. A lot of role playing. Tasha can talk about some of the role plays that they
well, we start
do
off
with the kids.
Talking about goals. So it's like, what do you want? What do you see for yourself? And then let's get into the facts about STDs and HIV in our community. Yeah, we can go national, but let's talk about what's going on in Rochester. And then it's talking about STD rates and how that is increasing in our city as well. How can you protect yourself from that? And then it goes into role playing. Okay, say you are with someone and they are pressuring you to have sex. How can you get out of that? Or even how to talk to your partner about wearing condoms, about talking about how to talk to your partner about birth control. So having those realistic conversations of, no, let's really go here. Let's pretend as if this is a very real conversation, because it may not be applicable to you now. Like some teens are not having sex, but in the future you may. So let's talk about that.
The study that I cited from the city said that adults assume that young people are receiving accurate information about sex and teen pregnancy. So you mentioned that, or so you said these are direct conversations that we're having right now with young people. The kids that were in the studies, 46% of high school students said their healthcare provider discussed pregnancy prevention and sexually transmitted diseases at their last checkup. That's 46%. I'm wondering if there is some type of a disconnect with that. Why aren't those numbers higher?
Well, the numbers aren't higher because it's an uncomfortable conversation to have. And what we are trying to do is take that stigma of the uncomfortable conversation away. So the other element of the conversations that we're having, not only are we talking to youth, we're also talking to parents. And we're having candid conversations about when parents need to talk to their children. And it becomes a taboo subject. Parents fear, one of the greatest fears is that conversation about sex and sexual health with their children. But they are the ones that the children respond to the most. Even when parents think their child isn't listening, they actually are. The other element of the conversation is youth are creating messages in social media and social marketing to reach their own age group. So that helps in establishing that conversation. You know, when you saw the video, some people didn't want to talk about it. It's because it is uncomfortable, but we have to remove that stigma and make it part of our conversation. So we incorporate it into other work that we do. And part of what the city is doing is, as part of the Summer of Opportunity Summer Employment Program, teen pregnancy discussions, teen pregnancy prevention training, sexual health behaviors is now part of that curriculum. So anyone who's providing employment to youth over the summer, they have to talk about sexual health with our youth.
I also want to just say this: we prefer the parents do it. We have social marketing that is coming in through the kids' phones, even on TV and so forth. So we would prefer that parents and that they get the correct information. So we do have a program, Family Talk, which is for parents to help them feel more comfortable talking about these subjects with their children.
Well, unfortunately, we are out of time for now. This is a very important conversation to have, and I appreciate all of you for what you do and for joining me today to have this discussion. Thank you. And you can get more information from the City of Rochester's efforts to provide educational resources and support when it comes to teen pregnancy prevention. Go to metrocouncilrochester.org.